The war on migrants in South African hospitals have exploded.
Are you immigration? You are not an immigration. This is my ID book. Call an immigration. No. This is my ID.
Whether you like it or not, you can say that. It's fine. It's fine. It's fine. And they change to enter here. Yes, then.
Operation Dudula movement are no longer on the streets. They are chasing out immigrants from their hospitals. At King Dinizulu Hospital in Durban in South Africa, they chased away a number of migrants from the hospital.
If you know that you are not a South African citizen, may you please stand up and leave our hospital. Thank you very much. Thank you, gentlemen. Thank you. If you are not a South African citizen, please leave our hospital.
They only ask authorities to stabilize and discharge them. No pills, no treatment, no health care for them.
Good morning, my good doctors. How are you? How are you, my good doctors? Anyone who is not a South African citizen, just because of their this side, please stabilize them. After they've been stabilized, you can discharge them. These people, they had too much privileges to have files in our hospital. It ends here and it ends now.
They even pointed to the Immigration Act, twisting and claiming that migrants need a medical permit for a medical care.
The Constitution allows that. Immigration Act 13 of 2002, Section 17, it simply states that a foreign national needs to have a medical permit and it needs to go to a private facility. You need to go and seek medical attention from a private facility, not here anymore.
We are supporting March in March organization. We have started already here to activate hospitals and the message is very clear. We don't want foreign nationals, documents, no documents.
And EID
This it's specifically to the MECs of health and the Minister of Health. Stop threatening us with prison. Stop threatening us with prison. It's either you join us in this fight, not unless
Africa, listen carefully. The war on migrants in South Africa is not slowing down anytime soon. They have intentionally decided to make Africans go back to their countries to go fix their country. And that is what is happening in South Africa. Now, Operation Dudula has moved from closing and locking stores to now chasing immigrants out of their hospitals. Even those in worse health conditions were asked to be stabilized and chased out of the hospitals, and they were prevented from taking medication, treatment, or even health care. They were rather asked to go to the private hospitals to assess them and allow South Africans to access their public hospitals.
Good doctors, may you please stabilize all the foreign nationals. After they've been stabilized, can you please discharge them? They need to go seek medical attention from a private facility, not here. You are a refugee. Yes. You came here legally. They could have directed you to the camp. Yeah. So they could have, whoever who allowed you to be a refugee here, not unless you bought your document. So whoever who allowed you here.
The problem is if South Africa doesn't even have one single doesn't have a refugee camp. I'm not in the camp.
Okay.
Whose problem is if I'm not?
Let me answer you then.
Who's the camp so I can go to?
Okay.
Which country do you come from?
I'm from Congo.
Congo.
You're from Congo. What is the nearest country to Congo? If you're seeking refuge in South Africa, because according to foreign policy,
you're supposed to
must migrate to them.
So you
cannot come to South Africa, seek refuge in a wrong country and ask us silly questions, ma'am.
No, the government.
Which government?
The government.
Which government? Which government you're talking about?
Let me tell you something. Shh. Keep quiet. We don't have time to reason with foreigners. Leave, my guy.
Let's go, ma'am.
No.
Let's go, ma'am.
Shush. Leave.
Let's go.
We don't reason with foreigners. We don't want the reason.
You ran away from your problems. You came here. You have your own government. Go vote there.
And members of Operation Dudula have vowed to ensure that only South Africans access quality healthcare in their hospitals. Migrants are going to be excluded. But Doctors Without Borders are calling this a humanitarian disaster. They have also revealed that there are more than 15 hospitals that immigrants have been prevented from accessing healthcare. And the situation situation is not restricted to only illegal immigrants. It is extended to even South Africans who cannot speak Zulu or any South African language.
I'd just like to clear up one misconception, which is that this is only impacting undocumented migrants. It is not. This is impacting even migrants who have valid visas, valid permits, valid IDs to show they are still being turned away from these health facilities. And some South Africans are as well. We have seen scenarios where a South African does not look or sound South African enough and also being turned away. We've heard stories of young people who've forgotten their IDs or don't have their IDs yet who have been turned away from clinics. So I think what the Section 27 of the Constitution guarantees the right of access to health to all who live in South Africa. So documentation status should not matter. But in this case, whenever we are saying only undocumented migrants, it's not actually true. But if I can take you to what we discovered when we did our assessment the other day, we've been getting these calls, we've been getting these reports with increasing frequency, a lot of very distressed patients. And when we went and took a look around clinics, we found that more than half of the 15 clinics that we were able to visit in person were physically blocked by members of anti-migrant groups. Then when we called up to 50 patients, we found that there were more than 24 facilities just in that group of 54 who were turning away patients.
Doctors Without Borders also revealed that this could escalate the health conditions of people in South Africa, as people with chronic health conditions like HIV, hepatitis, diabetes, so on and so on, are being prevented from taking their medications.
And we are particularly concerned about patients who really need to access healthcare, such as pregnant women, babies, and people living with chronic conditions like HIV. As we know, it is extremely dangerous for all of us, as South Africans or non-South Africans, if ARVs are stopped for people with HIV. That can be a real public health issue.
They also accuse health professionals and some security guards guarding these hospitals of also colluding with Operation Dudula to sack and chase out immigrants.
So we were getting a lot of reports of that as well, but we do not speak about things unless we have witnessed them with our own eyes, which is why we sent teams to clinics, because we are a completely neutral and impartial organization. We do not receive funding from any government or anything like that, particularly so that we can adhere to our strongest principle, which is to witness what is going on in different health systems and speak out about that. So, I mean, it is up to people whether they take us at our word or not, but I can assure you that at least 2 clinics, we saw situations with our own eyes that showed us that security was working with Dudula. In fact, doing the job for Dudula in some cases. And in another facility, we saw healthcare workers who were actively collaborating and supporting with the group that was stationed outside. So we know that this is happening. I'm quite sure it's happening at more places than what we have seen. But as I said, we are speaking only about exactly what we have seen. And to be honest, that is extremely concerning and very unethical of the healthcare workers and the security involved. So we are very worried about that. We have flagged it to the Department of Health, and we have named the facilities to them that we witnessed this at and asked them to address it immediately.
But spokesperson for the South African Health Department, Foster Mohale, has asked that anybody who has any shred of evidence should report to them or even make it known for them to take action.
We've heard those rumors like you are saying now, and we appeal to anyone who has got a shred of evidence which confirms or suggests that our healthcare workers have colluded with members of Operation Dudula, and so that we can be able to act accordingly. But until such time we receive tangible evidence, it's going to be difficult for us to act according to those rumors. So hence we say anyone who has got the evidence, they must share with us the evidence so that we can be able to act accordingly, precisely because our healthcare workers, they signed or they took an Hippocratic oath which says they will never discriminate against any healthcare user based on nationality or any reasons. So they are going to uphold the oath, a Hippocratic oath, and the Constitution and other laws of the country. So where we stand now, we don't have any evidence to suggest that our healthcare workers or some of our healthcare workers, they are colluding with members of Operation Dudula. So we appeal to anyone, including yourself, and Doctors Without Borders to share that evidence so that we can act accordingly.
He also revealed that any person who is being chased out of any hospital should immediately report to the police.
What we have done is that we have informed all our provincial managers to say anyone who happens to any health facility which experiences protest actions which interferes with access to health care, they must immediately inform the nearest police stations, the commanders, to ensure that they deploy the police to the affected health facility to uphold the law, to ensure that the protests, they do not interfere with access to healthcare facility.
But the mere presence of even the SAPS police is not scaring Operation Dudula away. They already quote the Constitution and work within the remit of the Constitution, leading them to have a standoff with the police many times.
Let's leave the Constitution. So where you are, what you are doing right now. Right now, La Peplet in Masindula next to the clinic, they were selling drugs publicly like they're selling sweets here. Right now, we're from there. They were selling drugs like they're selling sweets, but we are here. They were selling drugs like they're selling sweets. I can even point out the guys. I can take you and point out the guys.
They are not ready to vacate the premises even when the police ask them to. As a result, 3 of their members were being arrested and detained and sent to court.
We are not against you. Vugani Makande, we are here to help you. Ukuthi silethele abantu ama-foreigner ngoba nehlula ukwenza umsebenzi wenu. Nini umsebenzi wenu ukuthi nibophe thina as Operation Dudula, and ayikho into wrong esiyenzayo. Right now we are going to Coast Clinic. Come and arrest us all. Let's go to Vivian Hall now.
But this rather angered and gingered their morale to go all out and chase foreigners out. And the fact is, they are not ready to stop anytime soon.
They stormed the maternity ward, demanding ID documents from patients to verify their nationalities. They were then arrested and they are appearing in court this morning. But you're hearing members from Operation Dudula saying now that they are not going to stop. They're in fact now going to another healthcare facility.
The South African Minister of Health, Dr. Aaron Motsoaledi, has condemned this protest by Operation Dudula and debunked the assertion that healthcare in South Africa is free for foreigners. He revealed that it is not free, it is only free for children. However, adults pay, but there are conditions for accessing the free healthcare.
I took them through this whole process of immigration, and I told them they might be solving what looks like a legitimate problem, but using wrong means, because in health, we treat everybody who enters there who is sick. And they can't expect us to chase people away when they are sick. Whatever the circumstances of their nationality is just not allowed in healthcare anyway. And they must not confuse issues. There is this belief that healthcare is free in South Africa, but not in any other country in the world. And I want to correct that. Healthcare is free for children under 6 and young women. That was declared by our founding president, Nelson Mandela, in 1995, I think. Yes, so we only offer free healthcare for pregnant women and children under 6 of whatever nationality. The other people are not offered free healthcare. They are charged, but the problem is, if you come to hospital without money and there's an emergency, there's no way you won't be treated.
Now, let's be real. I mean, South Africa is hurting. Their resources are being used. Their healthcare system is collapsing, and people will have to queue long hours before getting access to healthcare. And the pain is real. But Doctors of No Borders reveal that there is a perception that foreigners are the one causing all these problems and using the health facilities. But foreigners who are using the health facility just make up about 4 to 7% of the entire immigrant population in South Africa, and that immigrants are not the reason for the deteriorating health sector in South Africa.
But what we're doing here is blaming the wrong people, and that is a problem. People seem to have this idea that there are just millions and millions and millions of migrants accessing healthcare in South Africa, and it's not true, despite what all misinformation, let me say, would have you believe. Migrants make up a very small part of our population. Let's say it's between 4 and 7% at the moment. Of those, many do not use public healthcare. The ones who do use public healthcare are the ones who don't have another choice. And often what we find is something that we call loosely the healthy migrant effect, which is that migrants do tend to be more healthy because they are migrants, because they have had to travel a long distance, or because they are not at home and they are nervous about going to healthcare for exactly these reasons. So the burden of migrants on the health system is vastly overstated. That said, I completely understand why South Africans are frustrated, and I really support communities in standing up against structural health system failures, but I do think we need to be targeting the right people for that.
Do you think South Africans are targeting the wrong people, or they are doing the right thing? Leave your comments in the comment section, and don't forget to share this video. Like, comment, subscribe, and it's a wrap for today.